Many of us have the habit of walking barefoot or wearing only socks around the house to feel comfortable. But this simple choice silently doubles your risk of a dangerous slip and fall. At 70 and beyond, your feet need a solid mechanical foundation from proper shoes to maintain balance and protect your joints from injury. I am Sophia, and today I will guide you through a very slow, safe routine to establish a secure space and protect your joints at home. Always listen to your body and stop immediately if you feel any sharp pain, dizziness, or shortness of breath. For this routine, make sure you are wearing low-heeled, slip-resistant shoes, clear your immediate path of any loose rugs or cords, and stand right next to a sturdy chair or counter for support. Let us begin by checking your posture and placing one hand firmly on your support. Look around your immediate area right now to ensure there are no clutter items or loose objects on the floor. Lighting is also incredibly important for preventing missteps, so ensure your room is bright and clear. If you have any history of sudden balance loss, please let someone nearby know you are practicing or position your chair right next to a solid wall. We want to build your physical confidence without forcing your body to struggle. Take a slow, deep breath in through your nose, let your shoulders drop completely, and breathe out fully through your mouth. Feel the stability of the floor beneath your shoes. Good. Keep your eyes open and focus your gaze on a steady point directly in front of you at eye level. This simple gaze alignment helps your brain stabilize your posture instantly. Keep a soft bend in your knees, never lock them out completely. Your hands should rest comfortably on your stable support as we prepare our bodies for the very first gentle activation. Make sure your base is wide, with your heels placed firmly beneath your hips to evenly distribute your body weight. Take one final centering breath as we lean into safety. Let us move directly into our first gentle activation to wake up the sensory receptors in your feet. Keeping your left foot completely flat and secure on the floor, slowly peel just your right heel up an inch, pressing down lightly through the ball of your foot. Hold it there for a moment, then slowly lower it back down. Let us do the same on the left side, lifting the left heel slightly while keeping the right foot securely anchored. As you alternate this gentle heel lifting, you are activating a vital system called proprioception. This is your brain's internal GPS, which constantly maps where your body is in space. When we walk barefoot or in ordinary socks inside the house, the friction coefficient drops drastically against smooth floors. Your feet slide, and more importantly, your brain loses those sharp sensory signals from the ground, causing a cautious, shortened gait that actually threatens your balance. By wearing a thin, firm midsole with a proper slip-resistant tread, you provide a clear, stable surface for those nerve endings to communicate with your mind. Let us continue alternating these small heel lifts for another 5 repetitions on each side. Lift the right heel, feel the stretch under the toes, and slowly lower. Lift the left heel, control the descent, and lower. Remember to breathe smoothly, letting the air flow naturally without holding your breath. This movement should feel completely easy and pain-free. If you feel any catching or discomfort in your toes or arches, simply reduce the height of the lift or take a brief rest. Your body adapts beautifully when we send the right signals through consistent, controlled repetition. You do not need to work harder. You need to send the right signal. Feel how the calves and ankles are starting to generate a gentle, warm sensation. This warmth means blood flow is increasing, bringing essential oxygen to the muscles that keep you steady. Let us finish the last lift on each side. Excellent. Now lower both heels completely. Feel the absolute grounding of your feet, and maintain your light grasp on your chair as we prepare to transition our focus to the back of the lower legs. Now that our ankles are warm and awake, we are ready for our first core strength movement, the supported heel raise. Stand tall right behind your sturdy chair, keeping your spine straight and elongated, as if a gentle thread is lifting the crown of your head toward the ceiling. Place both of your hands flat and comfortable on the top of the chair back for absolute security. Your feet should be hip-width apart, pointing straight ahead, with your toes relaxed and spread wide inside your shoes. Take a slow, deep breath in to prepare. As you begin to smoothly breathe out through your mouth, push down into the balls of both feet and lift your heels off the floor. Rise up into a comfortable height, matching your own ability. Do not rush to the very top if it makes you feel unsteady. Hold this elevated position for a solid count of 2 seconds, keeping your ankles stable and straight without letting them bow outward. Inhale slowly as you spend a full 3 seconds lowering your heels back down until they softly touch the floor. Let us perform this controlled movement together for a set of 8 repetitions. Breathe out as you rise up smoothly, hold for 1, 2, and breathe in as you lower down with total control, 3, 2, 1. That is one beautiful repetition. As we continue to the second rep, notice your posture. A common mistake here is leaning your upper body forward over the chair, or bending at the hips to force your heels higher. Avoid pushing your weight onto your hands or gripping the chair tightly with white knuckles. Your hands are there strictly for balance support, not to carry your body weight. Keep your hips stacked directly over your ankles and let the strong muscles in the back of your lower legs do the work. If lifting both heels together feels too demanding or causes your legs to shake uncomfortably, you can easily use a lighter modification. Simply reduce the range of motion by lifting your heels just a tiny fraction of an inch off the floor, or lift one heel at a time while keeping the opposite foot completely flat and supportive. Let us focus entirely on quality and control rather than height. Complete 4 more steady repetitions at your own gentle pace. Rise up smoothly, hold with stability, and lower down with absolute grace. When you raise your heels, you are actively engaging 2 major groups of calf muscles, the gastrocnemius and the soleus. Think of these muscles as a highly efficient, built-in shock absorption system for your lower body. When these lower leg muscles are strong and active, they absorb a significant portion of the impact force generated every time your feet strike the ground during daily walking. This mechanical support creates a protective counterpull force that actively reduces the loading pressure inside your kneecap and knee joint, allowing you to move with far less joint friction. Understanding this internal mechanism helps you see why gentle, intentional movement is so powerful for joint preservation. However, if you currently manage specific conditions like heel spurs or plantar fasciitis, we must modify this exercise to keep your tissue protected. A common misunderstanding in fitness is the belief that a greater range of motion is always better for everyone. For an inflamed plantar fascia, lifting your heels too high can overstretch the thick band of connective tissue running under your foot, leading to a sharp, stabbing heel pain. If you have heel spurs or chronic foot pain, I want you to perform a shallow version of this movement. Only lift your heels a tiny fraction of an inch off the ground, just enough to slip a piece of paper underneath your shoes. This minimal lift still activates your calf muscles beautifully without putting excessive tension on your arches or heel bones. Conversely, if you cope with varicose veins or a frequent feeling of heavy, swollen legs, this precise movement is an exceptional tool for your lower limb circulation. Your calf muscles literally function as a secondary mechanical pump for your circulatory system. Every time you squeeze these muscles during a heel raise, they gently compress the deep veins in your lower legs, driving stagnant fluid and blood back up toward your heart and reducing venous pressure. Let us take a brief 15-second pause right here to let your body rest. Stand completely flat on both feet, relax your grip on your support, and take a deep breath. A normal reaction is a mild, warm sensation or a dull tightness in the center of the calf muscle. A bad signal is a sharp, burning sensation at the back of your ankle or under your heel. Never try to push through sharp pain. Your body thrives on steady, precise signals, not on forced strain. Let us transition smoothly to our next fundamental strength builder, the supported mini squat. This movement specifically targets the large muscles on the front of your thighs, known as the quadriceps, which serve as the primary stabilizer for your kneecaps and protect your entire knee joint structure. Ensure your feet are spaced comfortably apart, roughly matching the width of your shoulders. Keep your eyes open. Look straight ahead at your eye-level focal point and check that your toes are pointing forward or just slightly outward, whichever feels most natural for your hips. Your hands should rest securely on the back of your sturdy chair or counter to provide continuous balance support. Take a slow, deep breath in through your nose. As you inhale, begin the movement not by bending your knees forward, but by gently sending your hips backward, exactly as if you are preparing to sit down on a high kitchen bar stool. Lower your hips down just a few inches into a shallow bend. It is absolutely vital that we keep this movement shallow, keeping your knee flexion well under 90 degrees. Going any deeper can place unnecessary, excessive pressure on your joint cartilage, whereas a mini squat provides excellent muscle activation while keeping the joint space entirely safe and comfortable. Pause at the bottom of this shallow bend for just 1 second. Feel the front of your thighs engaging to hold you steady. As you smoothly breathe out through your mouth, push firmly through your entire foot, driving through your heels to return to your tall standing position. As you stand up, remember to keep a soft bend in your knees at the top. Do not lock your joints out aggressively. Let us perform a controlled sequence of 10 repetitions together. Inhale slowly as you glide your hips back and down into that safe, shallow position. Keep your chest up and your spine long. Hold for a brief moment, then exhale as you push the floor away to stand tall. That is 1. Let us move into the second repetition. Focus on keeping your knees tracking in a straight line directly over your second toes, never allowing them to cave inward toward each other. Keep your breathing perfectly synchronized with your movement, inhaling on the way down and exhaling as you push upward. If you ever feel a mild, dull ache building up in your thighs, that is a normal sign of your quadriceps waking up and working. Keep your hand grip light and dependable as we finish our remaining repetitions. Let us take a steady 15-second rest right here, standing completely tall and allowing your thigh muscles to relax. While your body rests, let us examine exactly what is happening inside your knee joint during this shallow movement. When you perform a mini squat and keep your knee bend strictly under 90 degrees, your quadriceps muscles pull upward on your patella, or kneecap. This action keeps the kneecap sliding smoothly and securely within its biological track, known as the trochlear groove, without grinding against the delicate joint cartilage beneath it. Research demonstrates that going into a deep squat drastically increases patellofemoral joint pressure, which can accelerate cartilage wear and tear in older adults. By restricting your depth to a shallow angle, you gain all the structural strength in your thighs while keeping the fluid pressure inside the joint completely safe and comfortable. Let us address a critical adjustment if you have a history of a total knee replacement, meniscus tear, or ligament injury. For a replaced knee or a sensitive meniscus, structural variations mean your joint requires a highly controlled path of motion. If you feel any clicking, pinching, or an uncomfortable structural block during the movement, you must modify your setup immediately. Instead of a freestanding mini squat, slide your back entirely flat against a smooth wall, step your feet about 12 inches forward, and gently slide down just 2 to 3 inches. This wall-supported variation removes the shearing forces from your knee joint and shifts the weight safely into your glutes and upper thighs. Another excellent option for sensitive joints is to increase your hand support. Place your hands firmly on a high kitchen counter and use your arm strength to assist your legs as you push back up to a standing position. This simple modification unloads a significant portion of your body weight from the knee structures, ensuring you receive the strength-building benefits without forcing your tissues to suffer. Remember that your joint architecture is highly adaptable when given the correct physical signals. Many older individuals conclude that a joint replacement or a past cartilage injury means they can never bend their knees again, but this is a profound misconception. The internal tissues require targeted, non-destructive stress to maintain structural integrity and prevent surrounding muscle atrophy. By using these customized wall slides or assisted counters, you are sending a precise signal to your brain that it is safe to activate your leg stabilizers. This buildup of physical confidence is exactly what translates into independent everyday movements, like stepping off curbs or getting out of a low car seat. Keep your breathing deep, fluid, and continuous as we prepare to transition to our final routine concept. Let us discuss a highly effective strategy called the microdosing protocol. You might think that to gain strength, you must complete all your exercises in one long, exhausting session. But for older joints, packing everything into a single hour can sometimes trigger localized inflammation, joint swelling, or muscle fatigue. Instead, spreading these small intentional movements across your day is far more beneficial for your joint biology. To understand why this works so beautifully, we must look at how your joint cartilage receives its daily nourishment. Unlike your muscles or other organs, articular cartilage does not have a direct blood supply to deliver oxygen and nutrients. It behaves exactly like a dense biological sponge. When you remain seated or still for hours, this sponge stays compressed, stagnant, and dry. But when you move, even through a single gentle heel raise or a shallow mini squat, you create an alternate compression and release inside the joint. This gentle pressure acts like a mechanical pump, stimulating the inner lining of your joint to release fresh synovial fluid. This fluid functions as a natural lubricant, washing over the joint surface, reducing friction, and feeding the cartilage cells. Let us integrate this cellular nutrition seamlessly into your regular daily schedule. Right after your morning breakfast, while waiting for your kettle to boil, perform just 8 controlled heel raises next to your kitchen counter. In the afternoon, after resting or watching the news, stand up slowly and complete 5 safe shallow mini squats to re-engage your thighs. Before your evening meal, approach your sturdy chair to practice another brief round of low ankle movements. Spacing these brief 5-minute movement slots throughout your normal day keeps your joints continuously basted in fluid, loose, and entirely resilient, without forcing your heart rate to spike or your muscles to feel overstressed. Your physical body adapts to what repeats, and sending these microsignals keeps your mobility smooth. Let us bring our bodies into a gentle cool-down state to complete this session safely. Let your arms hang loosely by your sides, drop your shoulders completely, and slowly shake out your right leg, then your left leg to release any remaining muscle tension. Take a deep, slow breath in through your nose, feel your chest expand, and exhale fully through your mouth, allowing your heart rate to return to its natural rhythm. The movements we practice today are fully supported by extensive medical literature in the United States. For instance, the renowned Mobilize Boston study revealed that over 51% of indoor slips and falls happen when older individuals walk barefoot, in loose slippers, or wearing only socks. More alarmingly, walking without proper footwear inside the home doubles your risk of suffering a severe fracture or head injury during a fall, carrying a dangerous odds ratio of 2.27. This is exactly why organizations like the CDC, through their official Steady initiative, recommend always wearing properly fitted, sturdy, low-heeled shoes under 1 inch with textured rubber outsoles for traction. Furthermore, clinical trials show that practicing controlled heel raises over just 5 weeks can increase your lower leg strength by 30 to 50%, drastically improving postural stability. For your knees, a 2022 geriatric study confirmed that shallow mini squats are significantly more effective at reducing arthritic pain and improving daily function than traditional straight leg exercises. To maintain these structural gains long-term, your joints also require the right biochemical building blocks. Remember that muscle and bone health go hand in hand. Ensure your daily nutrition includes high-quality protein to fight age-related muscle wasting, along with optimal amounts of vitamin D and calcium to preserve bone density and prevent osteoporosis. If this routine made your lower legs feel a bit warmer and your stance more grounded, please hit the like button and save this video so you can easily return to it tomorrow. Your body thrives on what repeats, and small daily signals are what protect your long-term independence. Subscribe to Doxophia for more evidence-based, safe routines, and share this session with a loved one who deserves to move with confidence. Thank you for practicing safely with me today.